And then we go to gestational diabetes. We'll talk about that more in the next slide. And then hypertension, chronic or gestational hypertension, and preeclampsia. We'll talk more about that coming up here as well. So gestational diabetes is an interesting issue that occurs in pregnancy. It occurs in about 3 to 7% of pregnant women. Gestational diabetes only occurs in pregnant moms. So what we see here is because of some of the hormones synthesized by the placenta, they are actually causing some insulin resistance. So the profile is somewhat like type 2 diabetes, where mom is still making insulin in the pancreas, but the cells just don't recognize it and use this. And this usually happens somewhere around the 24th week of pregnancy. So that would be when moms are typically tested. They're given a really sugary drink, a glucose load, and then their blood sugar is measured after that to determine if their cells can utilize that insulin efficiently. Typically, what happens with moms that have gestational diabetes, if blood sugars are not well controlled, is that we just more often see a chubbier baby. So I want you to think about that placenta and the umbilical cord and the nutrients that's going from mom to baby. If mom's blood sugars are high, basically that baby's getting a main line of glucose or sugar. So the baby's just going to get nice and fat in uterus and may cause some difficulty with labor and delivery and an increased need for a cesarean section. Then we also see some lower blood sugars in baby right after birth, because as you can imagine, that nutrient supply is cut off when that cord is cut, and that baby's pancreas is working overtime to get that glucose lowered, and they could see some low blood sugar. So babies will just get a few more pokes after they're born just to make sure that their blood sugar is normal. Hypertension, pre-existing hypertension that's not well controlled, we could see a low birth weight infant, and we can also see a phenomenon where the placenta separates, and that could be life-threatening. Pregnancy-induced hypertension, usually it's like gestational diabetes. Once the baby's born, in the case of gestational diabetes, the placenta is removed, those hormones are no longer produced, the issue typically goes away. Edema, some swelling is normal. And again, those placenta hormones, they can cause the body to retain some fluid. No need for a salt restriction or diuretics that are going to flush the body. Basically, we want to monitor that edema because we know some is normal. If there is very high blood pressure and then protein spilling in the urine, that can lead to preeclampsia, which is the next slide, and that's when we get concerned. I do want to point out there's a really good video on Amazon. It's called The Weight of the Nation, and they have a pregnancy segment. So if you're an Amazon Prime member and you have access to that, I highly recommend watching that video. I have it linked in Blackboard. And just know that those videos that I have linked there are not mandatory for you to watch, but they do have some really good information. That section is about 30 minutes. If you want to watch that, Weight of the Nation has more to do with moms going into pregnancy, overweight or obese, and the risk of gestational diabetes. So preeclampsia, symptoms of preeclampsia are hypertension, protein in the urine, and whole body edema. What we can see with preeclampsia, if you turn to page 287 in your text and look at table 10.6, this happens usually in the first pregnancy after about 20 weeks. And if it is not treated, can lead to eclampsia, which could then lead to the demise of mom or baby. Women with obesity, diabetes, greater than 35 years of age, family history, inadequate diet are at greater risk for preeclampsia and or pregnancy-induced